we're talking about rhinoplasty this morning, more commonly known as a nose job. It's one of the most commonly performed cosmetic surgeries. Here to explain how it works and who can benefit and what you can expect from the procedure, facial cosmetic surgeon Dr. Christina Zachary. Also want to mention and congratulate you on your Avenue Top 40 Under 40, Dr. Zachary.
Much. It's so exciting.
Okay, so this, as an outsider, somebody who's never had cosmetic surgery, seems scary. So what are some of the reasons that people would consider something like this?
Well, rhinoplasty surgery, or nose reshaping surgery, is the most common surgery for men and women under 35 years old. And it's a nose reshaping surgery, so it's good to improve the appearance of the nose, so to reduce a large bump on the nose, or refine the tip, or improve the lip-nose angle, or narrow or straighten a crooked nose. So there are many different reasons why a person would want to have a rhinoplasty.
And so, okay, if somebody thought, you know what, I'm just really not happy with the way that my nose is, and they wanted to have a consultation, it would be pretty thorough, I'm imagining.
So a consultation is a very important step in the process, because it's important to learn about how the surgery is performed, what the recovery time is like, what the risks are, because there are some small but real risks of surgery, and it's important to be able to understand what those are and be able to accept them.
Right. Okay, so let's talk about the procedure itself. What is involved?
So typically it's a day surgery, so it's done and you can go home on the same day. It's done usually under local anesthetic or general anesthetic with sedation, and then it's done through little incisions through the inside of the nose and sometimes in the middle between the nostrils, which when those heal, those incisions are practically invisible. And for about a week, the patient would have a cast on the nose, and you're usually socially acceptable after about 2 weeks. The nose looks better after 6 weeks, but the final refinement is seen at about 2 to 5 years later.
Have things kind of come a long way, or is this how it's always been done, or have a lot of advancements
There have been
made?
a lot of advancements. The procedure has changed from more of an excision sort of removal of tissue procedure to more of a conservative procedure where you maintain the structure of the nose, just refine it. And so there have been improvements and modifications of the procedure.
Okay, so let's say somebody is really contemplating this seriously. What would you recommend they do in terms of sort of researching, self-exploration, and looking at the right surgeon for them?
Well, a good candidate for rhinoplasty surgery is somebody who's had a specific concern about their nose, or specific concerns that they can identify that are long-standing and confirmed. They have reasonable expectations for the result. The result should be an improvement, not a perfection, because it's a very detailed and complex surgery. And of course, they must be psychologically and medically healthy. You're not a good candidate for rhinoplasty if you expect perfection to be happy, and also if you expect the surgery to magically change your life in a special way, and also if you're not, you know, comfortable with your decision to proceed with the operation.
And those are all things that you would examine during a consultation.
Absolutely.
You would look at the state of mind and motivation.
Absolutely.
And,
a good surgeon is somebody who's had good training and experience and expertise in this surgery. It's the most complex of all cosmetic surgeries. And so typically a facial cosmetic surgeon is a surgeon who's had 5 years of training in ear, nose, and throat, head and neck surgery, and then facial plastic surgery extra training. So they're well trained and equipped and ready to do this kind of surgery.
As are you, Dr. Zachary. How do people find you?
On the internet, my website is a good way, www.facialcosmeticsurgery.ca, and also you can call my office.
Dr. Christina Zachary will have links to her website on our website, breakfasttelevision.ca. It is lovely to see you. Thank you so much for coming by today.